Now, expertise is more about the topic, and for us as writers, we think, oh, of course, expertise is coming from a healthcare professional with credentials in the field. Of course, that's ideal, but expertise can mean so many different things. You could be a scientist with a PhD on this topic, which makes you an expert in a different way. Or you could be someone who doesn't have any credentials, and you're not a scientist, but you've written health content for 10 to 20 years. That's where your expertise is coming from. Another example is if, as I see with my mentees, many of them have lived experience of a condition as a patient. And so if they write specifically about this condition to share the experience of a patient, then they become the most credible on this topic. So I hope you see from this that based on what you have, your profile, your experience, the way you communicate about yourself makes you more or less credible depending on the context. So the same profile can reach different credibility levels depending on the topic, on the client. So what you need to know is what you have for yourself and how you can leverage that. I'll show you some examples as always. And before we go into biographies, just to explain the different ways you can transfer your expertise besides your profile. Well-written content, obviously, appropriate language at the level of your audience, 10-year-old in the case of a lay audience, proper grammar, and even if you're a native English speaker and you write in English, make sure you know where the audience is based. If you should use US or UK English, for example, I tend to mix those two in my own content. Don't do that in blog articles. You need to know which information is valuable, so you need to, so you know how much depth you can cover. Some articles will be more comprehensive than others. The most important thing is you're being relevant for the audience. You're only mentioning what's really helpful for them specifically. And then with the bios, we're going to see any type of qualification, credential, certification, or experience you can leverage, how a bio should look like, what is best practice. And then even if you're not an expert, as it is the case myself most of the time, I'm not an expert on specific topics except for SEO, but for my clients. So instead, I have learned how to report and quote experts specifically, so healthcare professionals in most cases, to share additional insights. So it's like a journalistic skill set that's very useful for SEO, and I will show you how to do that if you're new to this.